Hello and welcome to Schein Chats. My name is Scott Jackson. I'm the Vice President of Surgical Solutions here at Henry Schein. And joining me today is Chad Ramos. Chad is the CEO at Privado Health. Chad, thanks for joining us today.
Pleasure to be here. Thanks, Scott.
Well, hey, Chad, we're gonna jump right into this. There's a handful of questions I have for you, and we're gonna start really on the clinical side. As far as how AI could be used in an ASC. And as we all know, AI is being used more and more so in healthcare, but specifically regarding how AI could be used in a surgery center is of really particular interest. And starting with the clinical side, from a clinical standpoint, Chad, what are ways that you think have been used or will be used to help with that decision-making process that could potentially enhance patient outcomes?
When we think about AI, and we're really intentional about it here at Privado, right? Like, as you said in that intro, we're really focused on being cutting edge, leveraging technology. We're building our own tech stack. We look at the processes. When we first started and launched last year, we started with the intellectual exercise of taking all the different steps in a surgery center and say, does this need to stay? Does this need to be optimized? Does this need to be thrown out? So we've really kind of been looking at that process redesign from the very beginning. And AI now plays a bigger part in that now than it's ever done before, right? And so as we look at AI and the potential of being used in a surgery center, in the healthcare setting, in particularly in outpatient, obviously, I see three kind of main areas of value that we think AI is going to bring to the surgery center. So the first one is, of course, around improving patient care and having humans spend more time with patients. And obviously, when you've got providers and nurses and surgeons able to spend more time with the patient, there's just going to be better outcomes. And so the first of the three kind of main value propositions that we see is improving patient outcomes by reducing the amount of administrative burdens that are happening in the space. And so when you have more people spending more time with patients, that comes to number two is on the burnout, right? And helping nurses and providers spend less time on administrative tasks. And AI has a tremendous opportunity there to help with that. We actually predict that 40%, up to 40% of tasks that are done in an ASC can be optimized and automated in a lot of ways. And so that's a big area there. And the third one is, of course, profitability. Harvard actually has a really cool study that just came out earlier this year that says that they believe that up to 10% of costs in the healthcare setting are going to be optimized. That's $360 billion a year in the next 5 years, where they think that is going to help with that. So those are the three main areas that we see in a surgery center of AI being able to bring value to the folks in an ASC setting.
Yeah, that's very helpful, Chad. And I'm glad you hit both the clinical and the financial impact that AI could have on an ASC, because when you think about the operations, you start with the clinical, and then obviously the financial piece is important as well. So thanks for bringing that into the scope. Also, I guess the next question is really around what are the steps that an ASC needs to take in order to implement AI, because this is relatively new for a lot of people, and myself included. So just curious, what are the steps that one would take to implement AI to some degree in an ASC?
Sure. So, just like implementing any technology in an ASC, you really have to start with where you're at. And so it's going to be so variable depending on how digitized your records are and all of those areas. But what we did at Privado and what we're currently doing every day is really trying to start with the smallest, we call them micro problems, the jobs to be done, right? Whether they be in scheduling or patient communication or RCM or supply chain, what are the smallest problems that you can solve, or that the jobs that need to be done, and then you can start applying AI to those very specific problems, because you can't boil the ocean, and ASCs, you've got so much to do anyways. So that's what I would recommend that ASC leaders take a look at, is what are the problems, boil them, or bring them down to the smallest portion, and say, how can AI help me with this area of patient communication, with this area of supply chain optimization, with this specific area of revenue cycle management. And then you can say, okay, which vendors can go help me do that? And I think that that is a really important distinction, is to be able, because for most ASCs, it's just not going to make sense to try to build your own AI algorithms. It's going to be partnering with groups out there that are already doing it. But you need to know what you're trying to accomplish, what your goals are specifically.
I would assume there's always going to be challenges, right? When you try and implement something new, it could be cost, could be staffing, could be a host of different areas. But are there any challenges that you foresee early on as far as ASC leaders being able to implement AI?
Yeah, for ASCs, the biggest issue is going to be integrating your processes, whether it be your EHR, your scheduling, your RCM, whatever, integrating them with some type of AI component. That's going to be the biggest limitation, unfortunately, right now, is that. But then there's also going to be the regulatory elements, and the bias that comes with AI, and having to have a lot of data for it to be really effective. Certainly no lack of challenges. There's lots of opportunities for ASCs to start implementing that, but regulatory issues and integration issues on the technology side are probably going to be the two biggest hurdles that we see over the next couple of years for ASCs specifically.
Yeah, that makes sense. I think we could spend pretty much all day talking about ASCs and AI and how it can be implemented. So Chad, this is a great discussion. One other question that we have is around, what are some examples of how ASCs have been using AI early on here in the adoption of AI within ASCs?
Yeah, obviously super early on, and so there's not tons of vendors in the ASC space that really have successfully deployed any AI projects. I think there's a lot coming, but some early on things that we're seeing around patient communication, getting that information kind of automated back and forth, and getting them prepared and making those reminders and gathering information. That's a really, really effective use case for AI right now. There's other really, I think significant use cases around helping with ordering and combining things like preference card data, inventory data, and scheduling data to predict ordering and what you need to order and when. There's a really great opportunity there. RCM has a huge opportunity to reduce the administrative burden around getting paid for these cases, and predicting which cases are going to pay and which CPT codes, and a lot of those particular areas. So really good information. I think the future, as we evolve and you've got more and more people digitizing their records and using technology for their day-to-day efforts, I think the future of AI and ASCs is allowing you to connect all the different siloed information that you have, whether it be schedulers or RCM or EHR or whatever it may be, to be able to leverage the data that is coming across all those different siloed platforms. I think that's the future of AI, but right now there's some really, really good companies out there doing some really, really great things with AI, even this early on.
I know we're out of time here, Chad. I want to thank you for taking the time to be with us today. Really appreciate your insights into this topic. Look forward to touching base with you in the future to learn more. And for those of you that are viewing today, thank you for tuning into Schein Chats. Take care.
Thanks, Scott. Appreciate it.